This is one of 6 educational videos designed for carers and staff supporting a child with a tracheostomy. This video outlines emergency tracheostomy tube changes. Emergencies are commonly caused by tube blockages, often due to mucus or clots, or by tube dislodgement. Managing these situations requires calm and swift action. Follow doctor's ABC. Danger. Check for safety. Response. Check if the child responds. Send for help. Call 000 at home or press the emergency buzzer in hospital. Airway. If blocked or dislodged, call Paediatric Code Blue. Dial 2222 in hospital. Breathing. Look, listen and feel. Compressions. Use the child's emergency tracheostomy kit. Scenario 1. Tube dislodgement. Check if the tracheostomy tube is dislodged. If so, remove it and insert a same-size tube from the emergency kit. Ideally, this is a 2-person procedure, but be ready to act alone. Slightly extend the child's neck using a rolled towel or blanket under the shoulders. Cut and remove the ties around the neck. Remove the old tube. Insert the new tube. Extend the neck further if needed, and use fingers to open the stoma. Remove the introducer and secure the tube with ties. Confirm the child is breathing and suction if necessary. Scenario 2. Tube blockage. If you suspect a blockage, attempt suctioning. If the catheter doesn't reach the pre-measured depth, the tube may be blocked. Change the inner cannula if has a double lumen tube. Slightly extend the child's neck with a rolled towel or blanket under the shoulders. Remove the tube. If it is a cuffed tube, deflate first. Insert the new same-size tube. Use fingers to open the stoma if needed. If reinsertion fails, try the smaller tube using lubricant. Still unable? Use a suction catheter as a guide. Thread the tube over it into the stoma, then remove the catheter once the tube is in place. Scenario 3. Tube in place, assess breathing. If the tracheostomy tube is in place and not blocked, check for breathing. Look for chest movement. Listen for breath sounds from the tube. Feel for airflow from the tube, nose or mouth. In hospital. If not breathing, connect a resuscitation bag with oxygen to the tube and give 2 effective breaths. Watch for chest rise and fall. In the community. Use a resuscitation bag with oxygen if available, or a one-way valve. Give 2 effective breaths. Watch for chest rise and fall. If air escapes from the nose or mouth, or the chest doesn't rise, gently close the nose and mouth with your hand. Reassess. If still not breathing, begin chest compressions. Scenario 4. Unable to reinsert, patent upper airway. If reinsertion fails and the child has a clear upper airway, look for chest movement. Listen for breath sounds from the nose, mouth and stoma. Feel for airflow. If not breathing, cover the stoma with gauze and tape to prevent air leaks. Use a bag and mask over the mouth and nose. Give 2 effective breaths. Reassess. If still not breathing, begin chest compressions. Scenario 5. Tube not in place. No upper airway. If the tracheostomy tube is out and the child has no upper airway, check for breathing via the stoma. Look, listen, and feel. If not breathing, give 2 effective breaths via the stoma using a bag and neonatal face mask. Reassess. If still not breathing, begin chest compressions. Compressions. Place the child on a firm surface. Use a slide mat if available to position safely. Find the centre of the chest. For infants, use 2 fingers or thumbs. For older children, use 1 or 2 hands on the lower half of the chest. Push down firmly and quickly, 30 compressions, then 2 breaths. Aim for 120 compressions per minute, pressing about 1/3 of the depth of the chest. Pause briefly to give breaths. If alone, remove the resuscitation bag from the tracheostomy tube to avoid dislodgement. Continue until the child responds or help arrives. In hospital with 2 responders, switch to 15 compressions and 2 breaths. Stay calm, follow the steps, and act quickly. Your response matters.